It's a system that's prepared.
It's a system that provides continuity of services.
It's a system that absorbs shocks without need for extra resources.
A responsive and reliant health system is a health system that will cover the need of all the people of the community, irrespective of their social and economic status. So, if you consider a health system that should have the quality of the care, and the quality should be equitable for all.
It's a system that supports health workers and trains them to be able to react and respond to different emerging threats and diseases.
And make sure that they're safe while doing it.
And paid on time.
Correct.
A system that involves the communities and is accountable to the communities.
I think it's a healthcare system which is resistant to shocks, and it can withstand, it's got sustainability, it can withstand anything that might come up against it, and also that people have a real ownership of that healthcare system, and that they're involved in the design of it and the delivery of it. So it's very much led from the community upwards, with buy-in from the top levels.
We're here to tell you what we think a resilient and responsive health system would look like. It's quite simple. Our name says it. Women in Global Health is striving to create greater gender equality in global health leadership, and we think that health systems need to be gender transformative to achieve this.
This is important because women make up 75% of the global health workforce. However, they only make up 25% of leadership positions. What this means is that women's health issues are often neglected at the decision-making table when policies are being designed because they don't have a voice at the table.
And exactly, if we're talking about creating more resilience and responsiveness, we need to tap into the entire talent pool, which includes women and all other genders. So we really hope that health systems around the world will be more gender transformative and enable all people of society to participate in their health.
I think it's one that takes into cognizance the needs of the community, incorporating the community members, the community leaders, and the one that is universal, that looks at equity, equality, and covers the needs of women, children, men without being segregatory. So I feel like that's a more responsive health system, and it should be resilient to any shocks, whereby the health system is ready for even infectious diseases like Ebola, cholera.
It is a system that is based on social justice, the end of the commodification of health care, that all stakeholders will collaborate like giant spiders, and ensuring that no matter how much or no matter how difficult any epidemiological profiles that seem to be pressing to the country will be able to be attended to without any unforeseen circumstances of a certain group of the population being subjected to catastrophic health payment.
Well, resilient and responsive health system for me is a health system that responds to people's needs during emergency situations, in terms of providing the health services that they need with an effective coverage and with appropriate equipment and supply of drugs, and that the cost of the provision of services doesn't overwhelm the capacity of the population to access those services.
Responsive and resilient health system applies to ensuring that health delivery services comes up efficiently and successfully, such that the objectives of setting up a healthcare facility and health policies are met, especially based on the responses of the end users. It means that different categories of stakeholders, both the policymakers and the funders and the end users, achieve their aims and objectives in a very effective and efficient manner.
I have adopted the concept of resilience to mean everyday resilience. So to understand not just the big shocks such as Ebola or the Zika virus, but to understand how can we get the health system to function on an everyday basis.
A resilient and responsive health system to me means a health system that meets the needs of everyone. Not just the richest, the smartest, the urbanized, but every single person.
A resilient and responsive health system to me has more in common with biological systems and ecological systems than really anything mechanical or constructed. The whole idea is to create a living complexity of a system that is aware of its environment. It is responsive in that it is alert and attentive to the needs of the communities that it serves and to all of the stakeholders who participate or engage. It's responsive to its environment. It is able to deal with changes in the economic strata or the climate changes, which probably carries over into the resilient aspect. A resilient health system is very closely related to being a responsive health system, but in that case, the stimuli, the external stimuli, are negative. Perhaps a crisis such as an epidemic or a pandemic outbreak or a climate crisis causes stresses on the health systems, and the ability to survive those stresses, even thrive under those stresses, is the resilience.
A resilient and responsive health system is one that has capacity to meet health needs of a given population, whether there is an epidemic, whether there is a shock to the system or not. A health system that is able to keep promoting the health of its people, even when it's trained by new hazards, man-made or not, or natural disasters. It should be one that is prepared for emergencies such as Ebola that we saw in West Africa, or SARS, or man-made hazards such as wars or natural disasters.
Resilient and responsible health system mean for me is basically they tailor to this local base as well as sustain in order to continue and that's what.
Resilient system is one that's able to respond to a crisis and able to resuscitate itself from its own ashes in order to develop systems in order to commence the business of government again, in order to respond to the needs of its people. Responsive health system is slightly different. It means that it's able to identify the most serious, frequent, and preventable causes of death and illness and be able to prioritize its resources to be able to address those which are most serious, frequent, and preventable. That's the difference between a resilient and a responsive health system, in my mind.
A resilient health system, for me, is a system that is able to absorb the shocks and stresses that come with the disasters that we are seeing today. In Kenya, for example, we've actually had a number of disasters and catastrophes, both political and natural, such as political violence following elections, floods and so on. So a health system that is really able to deal with all these disasters and catastrophes. And they don't even have to be disasters on a big scale, but even the smaller disasters that, also lead to a lot of morbidity and mortality if not well addressed. So yeah, for me that's what a resilient health system means. So we need to invest in human resources. We need to invest in structures in order to be able to build these resilient health systems that we're talking about.
It should be able to respond to the emergencies that arise, or even just the needs of, say, children and mothers who need vaccination and maternal and child health services. So we need to invest more to be able to have responsive health systems, to be able to deal with anything that comes up in the whole system and serve our citizens much better.
Allô, bonjour, mon nom c'est Stella Tiné. Je suis
actuellement étudiante en deuxième année, PhD, à l'Université de Montréal. Je suis médecin de formation, je suis camerounaise et je viens de l'Afrique centrale, mais j'ai fait mes études en Afrique de l'Ouest. Donc actuellement, je fais ce programme parce que dans le passé, j'ai travaillé pour des organisations internationales, j'ai fait du terrain, je travaille avec Médecins sans frontières, je travaille avec Action contre la faim, et comme dans des programmes d'intervention et dans des programmes de recherche et j'ai pris conscience de beaucoup de gaps et de beaucoup de choses qui existaient et des choses qu'il fallait adresser.